it's Dr. Pat with Little Critters, and we have an African Gray with us today. It's a Timna African Gray, and I'm somewhat holding her up here because she has very severe balance loss. She's having trouble standing at all. She can't perch anymore. She's lost a substantial amount of weight. You can see she's just struggling even to place her toes appropriately. She keeps curling under her toes. She also has very severe feather changes. Owner brought her in for what she thought was feather picking on her chest. He hasn't actually seen her do that. And what we noticed on the physical exam is very abnormal feathers under her wing and over her rump, and these are actually falling out during the exam. And when I say abnormal, we don't have full feather development. The feathers are actually blunted at the ends. They're not typical or normal pin feathers, and of course they shouldn't just be falling out. We have several concerns with her. Obviously the balance loss is the most significant one, and that's obviously the most concerning for quality of life. Balance loss can be caused by a number of factors in birds. Viruses are certainly one consideration. We will often see feather loss in blended feathers with things like Bornavirus or Cytosine beacon feather disease. We can see neurologic conditions with many viruses. The circovirus was formerly called macaw wasting disease, is one of those viruses. Pacheco's, which is much more serious and often more acute, is a herpes virus of birds, which can also cause neurologic symptoms. We always worry about things like heavy metal toxicity in birds that can cause neurologic disease. And then I would add on otitis interna, or an infection of the inner ear, which could also cause balance issues, and then metabolic disease such as liver disease. So we are doing viral testing on her today and getting some blood work, looking for the primary problem to see if we are able to intervene and fix this and improve her quality of life. Because right now the quality is highly questionable, and we're very worried about her. And you can see she still is mentally alert. She still acts like an African Gray, and she'll sass at us. But this is very stressful and very scary for her. And we're dedicated to trying to find out what's going on and doing our best to correct this and give her a good functional quality of life if at all possible.